My name is Laura Bama. I have a clinical doctorate of physical therapy, and I'm a physical therapist with the Cancer Rehabilitation program called ACTIVE at Swedish Medical Center. I have been asked to speak with you about cancer survivorship and rehabilitation. In this podcast, I will discuss many factors individuals might face after their cancer treatment. Survivorship begins with a diagnosis and continues throughout the rest of one's life. Because survival rates have continued to increase, people are leading full and active lives after cancer. However, challenges also arise from increased survivorship as people learn to cope with such issues such as body image, pain, or difficult emotions. Symptoms can arise after treatment, and some won't go away when treatment is finished. Certain symptoms will need to be managed for the rest of the survivor's life. Emotionally, most survivors have a degree of fear or uncertainty of recurrence. They may fear discrimination from employers. Survivors may change jobs, while others do not or cannot return to work. Personal relationships may change, as some become more significant and others less meaningful. Often people examine the meaning of their life and find increased spirituality and therefore adopt healthier lifestyles. Having a plan after treatment can help. It is important to discuss your after-treatment plan with your physician. Your oncologist or primary care doctor will follow up with your care after treatment. Optimally, follow-up care includes regular monitoring and managing of late and long-term effects of cancer treatment and cancer screening at certain intervals. Your physician may refer you to a specialist, such as a social worker, mental health professional, psycho-oncologist, physical therapist, occupational therapist, or rehabilitation physician. These professionals are trained in helping survivors with their challenges. The most common problems after treatment may include fatigue, neuropathy, lymphedema, mouth and teeth problems, changes in weight or eating habits, trouble swallowing, bladder and bowel control, memory and concentration problems, and menopause symptoms. Post-treatment symptoms can vary person to person, even between two people who have had the same cancer and treatment. It can be frustrating not knowing what to expect after treatment and if your symptoms will ever go away. Common symptoms and their management will now be discussed in more detail. Talk to your doctor if you're having any of the following symptoms. Fatigue. There are various causes for fatigue, some of which are yet unknown. Fatigue may be from cancer treatment, anemia, insomnia, or depression. It is important to talk with your doctor about fatigue. In order to cope with fatigue, it's a good idea to plan your day so important tasks are done at the time of the day you feel the most alert. Letting others help you, taking rest breaks throughout the day, and going to bed and waking up at the same time can help. Memory and concentration. This system may be affected due to chemotherapy or radiation and is sometimes referred to as chemobrain. It may also be due to other factors as well, such as medication, fatigue, or depression. Keeping a planner to write down important dates and putting post-it note reminders around the house can help. Pain. Pain after treatment can arise from nerves injured during treatment as a result of surgery, chemo, or radiation. Your doctor can prescribe medicines that can help, or you may find help from physical therapy, meditation, or relaxation. Nervous system. Usually, neuropathy occurs in the hands or feet, and people describe it as tingling, numb, or burning. Lacking feeling in the hands or feet can lead to injuries such as falls or burning oneself. Wearing good shoes can reduce falls. Using a thermometer and gloves when cooking or running a bath reduces the chances of burning oneself. Neuropathy can improve over time, even a year out from treatment. Lymphedema. Lymphedema is swelling that occurs from a building up of lymph fluid, usually in the arm, leg, or face. The most common cause is damage or removal of lymph nodes during surgery or radiation. Symptoms can occur even years after treatment. A lymphedema-trained therapist can help you manage these symptoms using strategies such as specific massage techniques, compression sleeves, and/or stockings. Listen to the Lymphedema podcast for more information. Resources. There are now many resources available to the growing number of cancer survivors, both within and outside of Swedish. Many patients of all types of cancers benefit from participation in support groups. talking with people with similar problems can be helpful and reassuring. Prayer or spiritual practice, humor, relaxation, and yoga can also help with the survivor's distress. Particularly helpful to those adapting to and living life beyond treatment is exercise. Exercise can help people during or after treatment. During treatment, it can reduce side effects such as fatigue. Continuing an exercise program is important in improving the quality of life of a survivor. The Active program at Swedish helps those who are going through treatment and those who are finished. The program is a medically supervised exercise and support program with specialists who treat cancer survivors. Those in the program learn specific exercises and begin a program that is individualized and goal-oriented. For example, after breast surgery, restoring full movement in the arms is often a goal. Patients learn how to improve their motion so that daily tasks like reaching overhead is regained. Restoring optimal function is important in survivorship. Oftentimes with treatment or even after treatment, patients report fatigue, which can be alleviated with exercise. Even 10 minutes of walking a day during treatment can mitigate the fatigue from treatment. The participant learns a cardio program and how to progress safely. The Active podcast provides further information on this program. Call 206-215-6333 for more information. At the Swedish Cancer Institute, there are support groups and education classes on virtually all types of cancer. Life After Treatment Cancer Survivor class teaches survivors how to manage physical and emotional concerns after treatment. Call 206-386-2502 to register. Other resources include Team Survivor Northwest. Cancer survivors in any part of treatment can participate in a variety of health education and fitness programs such as walking, dancing, and dragon boating, all designed to support the cancer survivor. Go to teamsurvivornorthwest.org for additional information. Gilda's Club has support and networking groups, offers a variety of lectures, workshops, and social events, all free of charge. Go to gildasclubseattle.org for more information. Cancer Lifeline provides information on free classes and support groups. For more information, visit www.cancerlifeline.org. In summary, the survivor of cancer has many avenues open to him or her. The Swedish Cancer Institute strongly supports cancer survivorship with many resources available to the survivor. Learning to cope successfully with challenges after cancer diagnosis is key to living a full and active life. Thank you for listening to the Plugged Into Your Health Cancer Podcast program, the Cancer Survivorship and Rehabilitation podcast in the Rehabilitation series.